All right, let's, excuse me. Let's get into our first big story now. Diabetes is not a death sentence. Let's have that at the back of our minds. But many people live with the disease and manage it effectively. Let's see this report.
Diabetes was once considered a rare disease in sub-Saharan Africa, but in 2010, over 12 million people in the sub-region were estimated to have the condition. Diabetes is presently a whirlwind sweeping through Africa. Today, there are cases of diabetes in rural areas. This counters the prevailing myth that diabetes is a disease of the rich. Even type 2 diabetes, which was typically regarded as a disease of the middle-aged and the elderly, is becoming increasingly common in children and adolescents. Africa is currently caught up in the diabetes epidemic, largely due to rapid urbanization.
When I was pregnant with my second daughter, I had gestational diabetes. So after my first daughter, 6 months after, before 6 months when I delivered her, it disappeared. And I was told that was what was going to happen. So I had my third daughter, it came back again. 6 weeks after, it disappeared. But 6 months after delivery, it came back. This time as a DM, as diabetes.
The last child of her parents, both of whom had diabetes, Chima has other siblings who are diabetic. She believes that coming to terms with being diabetic and speaking to the right people about it is essential to survival. Diabetes treatment requires active participation by the person who has it. Monitoring your blood sugar level on a regular basis and analyzing the results is a crucial part of the treatment equation. One of the main aims of diabetes treatment is to keep blood glucose levels within a specified target range, and all of Chima's children understand this. As required by all diabetic patients, Chima takes a quick and easy finger stick screening regularly that measures blood sugar levels following hours of fasting. Testing with a blood glucose meter is also the best way to see the immediate effect of factors like food choices on the blood sugar, so the patient can take action to bring high or low sugar back into range. Dr. Dada is a chemical pathologist. She is a member of the Medical Women Association of Nigeria, a group that regularly conducts diabetes screening and other public health outreach programs for the public. She says away from the patient testing with blood glucose meter at home, the healthcare professional uses an A1C test. This is performed by the doctor. The test measures the average blood sugar levels by taking a sample of the hemoglobin A1C cells, a specific component of the red blood cells. This important clinical laboratory test gives the patient and the doctor a look at the long-term blood sugar control. In Africa today, a large percentage of the population suffers from type 2 diabetes, with many countries lacking national diabetes program, and accessing drug is becoming increasingly difficult for those who have diabetes, as diagnosis can be pretty daunting without access to supplies.
All right, with us in the studio is a consultant endocrinologist and a senior lecturer at the College of Medicine, University of Lagos, Dr. Ifedayo Adeola Odeniyi. It's good to have you. Odeniyi, exactly.
Odeniyi.
Odeniyi.
Okay,
Thanks for joining us right now.
It's good to be here.
Yes, right. And we also have in this, well, okay. Is it Abuja studio now? Or Sarenko Chima Nwogugu, who has been living with diabetes. It will be nice to have a perspective of a sufferer there and how he's been managing it. But first, Dr. Odeniyi, good morning.
Good morning.
Well, reading up on this, 5 million Nigerians, Nigerian adults, actually down with diabetes, not to talk of juvenile diabetes.
Yes.
Why is it so bad?
It's been with us. It's just that the awareness is getting more and we're making more diagnoses. And that number will increase if nothing is done by the year 2040. We'll have 1 out of 10 people living with diabetes. And that is quite daunting and challenging. Nigeria is not the only place in the world where we have sufferers. It's there all over the world. In 2015, more than 400 million people worldwide suffers from diabetes mellitus, and it's projected by 2040, more than 600 million people worldwide will come down with diabetes.
Okay, we'll come back to getting more of these facts. Let's go on a break, and then we come back to dwell on this. Stay with us on TVC Breakfast. All right, if you're just joining us, you're watching TVC Breakfast, and on this segment, we are discussing diabetes, the rate of diabetes prevalence in Nigeria and parts of the world. We have with us in the studio a senior lecturer and consultant and endocrinologist, Dr. Ifedayo Odeniyi, with us. And good morning, it's good to see you again. And certainly we have Osai Hoe Chima Nwogugu. Did I get the name correctly?
Very well.
Okay. It's good to have you join us. Welcome.
Thank you very much.
Now, we featured you in one of our reports earlier on, and people were getting to understand how diabetes is managed and all of that. The doctor was giving us a background to what these things are, the prevalence level. Now, you are someone living with diabetes. Tell us how you have been managing the circumstance.
Well, is it a circumstance?
Oh, maybe managing diabetes. Okay, let me put
yes.
it straight like
Well,
that.
I was gestational. There are different types of diabetics. I was pregnant, my second baby, when I was diagnosed of gestational diabetics. And after the first delivery, we went back to normal. I was told everything is okay. Then my third born was when I had it again, and then eyes were on me that I should be careful. And again, it went back. But 6 months after, I noticed I was having rash, and I was having discomfort in my reproductive area. And that's when I told my husband I'm concerned. I was still breastfeeding. I did exclusive breastfeeding. And then we had to go to see a doctor. They now referred us to endocrinology, who now did some tests and confirmed that I was now a diabetic. It was a shock because my parents both died of, they both had diabetics. My mom died of complication. She had a foot ulcer that killed her after amputation, and it was poorly managed, though she had doctors. You know, then in 1999 in Edo State, they were not that aware the way we are now. Endocrinologies, I thought then I didn't even know what was endocrinology until I had it.
Still sounds very
yes.
I was trying to even pronounce the word. I was trying to pronounce, and it was a mouthful.
So
But it's really
endocrinology
interesting.
I was lucky. I was the first person I was referred to was not the doctor. My gyne, the hospital I was using had endocrinology on their list, and they referred me to him, and immediately he took action, and he made it look so simple.
That's wonderful.
He just told me it's not a big deal, there's no problem. But the challenge is, you know, it's a strange thing. Your mom died of it less than 5 years ago. Your dad had it all your life. I grew up to know that my dad had diabetics, but he managed his own very well. He was a very strict person, but with no information. Okay, so I have lived with it for 16 years now, because that girl I had when I had gestation is now 15 plus. So plus or minus, he knows you're supposed to have 3 years.
Plus or minus 5.
5 years.
Between
but
5 to 10.
Yes,
Okay.
before that means I already had the trait of it in my system.
Even before you got pregnant?
Oh yes.
Yeah.
Okay.
So they had
And after
3 to 5 years to it, but I didn't do that. I just told you 16. So if I add that, I will be
That's
about
what-
20 years or more. Has been living with diabetes.
Maybe we should, you know, for clarity, you know, what exactly is diabetes? You'll be surprised that in 2016 there are people who are still wondering exactly what is diabetes, so that, you know, we should take off properly from there.
Okay, diabetes is a medical condition where the body cannot make use of glucose, which we interchangeably use as sugar. The body cannot make use of it. Now, why is glucose very necessary? That is what the body uses to generate energy. That is what the body uses to function very well. And so all the food we eat, the final pathway is glucose. Now, I liken it to glucose is the currency that the body spends. Yes. You want to go to America, you need to change your naira to dollar. Okay? And that's the same thing. Whether you are eating amala, eba, fufu, pounded yam, it must go finally to glucose. Now, the body cannot make use of glucose, and that is what the problem with diabetes is. Now, why can't the body make use of glucose? Because a chemical that we call insulin is not there, and that is what we have in children who have diabetes, or is there in adults, but the quantity is small. Okay. Or is there in adults, the quantity is small, and even that small quantity is not working very well.
See, sorry, when you say that the body cannot make use of glucose, the question that readily comes to mind, because we know there are different sources of glucose or sugar. Are you talking about artificial glucose or sugar, or all forms, whether it's natural or artificial?
Whichever one. Okay. The final thing is the body must process whatever we have consumed into glucose. That's the final pathway. Now, insulin is like the key that opens door for this glucose to enter into the body cells, to be broken down into energy. And that's why the kidney can function, the muscles can move, everything can move. The only organ that don't need insulin to use glucose is the brain. Because you can imagine if brain needs glucose to use, need insulin to use glucose, everybody will be dead. Wow. So God has made it so perfectly well that the brain will not need insulin to use glucose.
All right. So at that point, what causes the body not to be able to use glucose, also to lose insulin, or not to be able to use glucose?
Over time, the cell in the body that produces insulin, which is the pancreas, the beta cell of the pancreas, the function continues to decline. It also declines with age. And so when the function declines, the insulin production also reduces. Now, apart from that, there is insensitivity to insulin, which we call insulin resistance. The body cannot respond to that insulin. And why is this so? When we are so fat, insulin will not work very well. And so these are things that predisposes the body not to be able to use glucose. Okay? And that is basically what happens in diabetes. It's a defect in the body because insulin is reduced and it is not working well. It is not from the spirit. And so when we meet patients sometimes and we say, oh, you have diabetes, God forbid, I reject it. Okay? And some people will say that, thing. They finally cut off with me from my village. No, it's not like that. It's just the body not functioning very well. How did we get to this stage? Our lifestyle. We consume calories that we don't burn. We don't exercise. Okay? We eat a lot of calorie-laden food. We've abandoned fibers. And we have a lot of fizzy drinks around.
Processed food.
Processed food. And so, what do we have? We gain weight. When we gain weight, insulin does not work well. And we are looking for diabetes.
So when we talk about the genetic factor, which in your case,
you can just call me Mrs. Chima.
Okay, thank you so much for saving me there, Mrs. Chima.
But I like African names. You need to get it.
I'm very proud of it. Yeah, it's so sweet.
No, the R is silent. The R is silent. Osai Hoy.
Yeah, you must be from
Okay. So there's the genetic factor.
Yes.
But when I hear that the genes have to do with diabetes or some of these other diseases, which doctor has even said, has to do with lifestyle. Is it because, say for example, father, mother, children, they all live in the same, home, they eat the same things and all of that.
Same lifestyle.
Isn't that still a lifestyle thing that actually,
Yes.
you know, might reduce the you know, so-called factor of genetics?
Yes, I will use my family as an example.
Okay.
I'm from a family of 10. My father and mother I had step brothers. I just lost, I lost a couple of them now. One to diabetics, complication, the other son, and my 2 other brothers to hypertension complication. And now I have 2 of my siblings who are also living with diabetes. So, and others are not. See, the ones that are living with diabetes, they are not fat. They're slim.
Okay.
But their lifestyle, my other sister that was confirmed diabetic in Canada, man, she wouldn't take this cup of tea without 10 cubes of sugar.
Whoa.
There you go.
Okay, that was her lifestyle.
Whoa.
And she was so slim and so beautiful, still beautiful. She's 55 now, 55, yeah, 54. She's 54 now. She looks like a 35-year-old lady. She's still very slim, but she's diabetic. She didn't know until she got over there, and I lived with it for years. They've been hearing I've been having my baby, but it didn't ring because they keep rejecting it. So when she told me, they said I'm diabetic, I said, oh, it's not a big deal, sister. I've been diabetic for years. She said, what? I bind it, reject it. I said, no, sister. So the point I'm trying to make here is I have other siblings who are not diabetic. Why? I have one that is a teacher. She's very careful what she eats.
Okay.
Very careful. I know how to be like that.
Did she start early?
Just a lifestyle. She's very careful what she eats. So she didn't know. She wasn't trying to avoid diabetes. Okay. It was just her lifestyle. She wanted to maintain her sweet, fine stature, and I think that's how she avoided it. I think a lot has to do with a lifestyle. I'm from Benin. What you eat, do you exercise? I was the only sports person.
With the starch and the wool and all the rest of it.
Well, we were not the wool thing, but the quantity of oil they were putting in. Yes, a lot of oil.
We'll come back, the doctor, we'll come back to this. And we'd like to know also how these things are managed when it comes to what food you eat and all of that. But let's go out on TVC Entertainment. Viewers there can continue with the program on TVC Nigeria, Comsat Channel 190 and DSTV Channel 418.
Also, GoTV 45 and ACTV 510. Stay with us. All right, you're welcome back. It's TVC Breakfast, and we are looking at diabetes. It is World Diabetes Day, and like our guest said, you know, she's really happy that TVC continues to, you know, beam the light on such issues. And, you know, a day like this, it's very important that we look at it. Our guest is in the studio, Dr. Ifedayo Odeniyi, and of course, Osayehwe Chima Nwogugu. She's living with diabetes. And we have just joining us in our Abuja studio, Ibrahim Yekasai. Okay.
Okay. Ibrahim certainly won't have it now.
Okay, not now.
Not now.
All right. So let's, you know, it's not a death sentence.
No.
No.
It's not.
No.
But for some people, for a lot of people, it has become a death sentence for them. Why is that?
Well, because a lot of myths have been wound around the diabetes. The person with diabetes can live with diabetes, and that person can live for as long as God has designed it, if that person follows the doctor's instruction and is able to maintain the lifestyle, use medication, ready to test the blood glucose as regularly as possible, and stay away from the don'ts. So it's not a death sentence.
And the don'ts are?
Exactly. That's all we need to know now. Because when you talk about habits, when you talk about lifestyle, we need to actually know what are these things.
Maybe we should start like this. We should prevent. Okay?
It's always better than cure.
Yes, we should prevent. And we should start preventing by adjusting our lifestyle. What do we mean by adjusting lifestyle? It's nothing difficult. Let us cut down on calories. The quantity of food we take, let's cut it down. Some people believe that, oh, I've taken breakfast, lunch, dinner, and in between breakfast and lunch, you've gone to, I don't want to name eateries, you've taken you've taken some snacks, and those ones are not considered as meal. he just ate these days at 12 noon and he said, lunch, 2 o'clock, I must go and eat that one. I bet you ate at 12. No, that's not food. And so we must reduce calorie. We must exercise. What is prescribed? 30 minutes every day of exercise is what we need. Okay? And we must make this very regular. The government needs to help in this way. Government must see health in all policies. Now, we are going to construct a new road. There must be a walkway. If there is a walkway, some of us can trek. Why will we
actual planning? I know in that report, you know, the reporter there did mention something about no national diabetes program that Nigeria has.
Well,
Nigeria hardly has any.
It's probably not so prominent. It's there.
Okay.
But what about implementation? So that is what we need to do to prevent. For those that have family history, they are at a very high risk of coming down with diabetes. They may not come down if they embrace this lifestyle and prevention. And that is all that we need to do to prevent it. Now, how do we manage those that have?
Already.
It's very, very simple. They cut down their calorie that they consume. They also need to exercise. And they must make sure that they check their glucose level. They work hand in hand with their doctor. Most of the work is done by the patient. Okay? The doctor only guide. And what are the food that we are talking about? I always feel sad when my patient come and says, I've been eating beans and unripe plantain. That is not correct. It's a sentence to death. That is what killed the patient fast.
Really?
Yes.
Because the food is now monotonous. You can imagine me giving you beans this morning, beans in the afternoon, akara in the night, one tomorrow morning.
Oh yeah, that's beans.
It's killing.
Okay.
So, diabetes patients can eat all food.
All. Underline that again.
All. Emphasis on all
including
food. Including everything. Wow. But the quantity must be small.
Okay. But we are used to, because in our society, we're very used to, okay, I don't eat that because I'm diabetic. I don't eat that because I'm diabetic. I don't eat that.
It is what people that believe that is what they should eat. Whether you eat pounded yam, rice, beans, or whatever, it is converted into glucose. Now, most people believe that beans is protein. Beans is not. Beans is 60% carbohydrates. And so, what is important is the quantity of what is consumed.
Okay. All right, Doctor, we'll come. That's an eye-opener.
Do you know why I'm shocked? Yesterday, I was home all through. I had beans in the morning.
Beans in the afternoon. Oh my God!
And I was, just excited about myself that there's no rice in my diet today, and no bread, and no yam. Only for the doctor to just bust my bubble right there. Wow!
All right, let's give out this information. November the 14th of every year is World Diabetes Day. The theme for this year is Eyes on Diabetes.
Yes, it focuses on promoting the importance of screening and treatment of type 2 diabetes in order to reduce the risk of complications. Now, World Diabetes Day was launched in 1991 by the International Diabetes Federation, IDF, and the World Health Organization, WHO, in response to the rapid rise of diabetes around the world.
Now, the main forms of diabetes are type 1 and type 2 diabetes. Now, type 2 diabetes makes about 96% of the common diabetes cases in Nigeria, and up to 70% of type 2 diabetes cases can be prevented by adopting healthier lifestyles.
Yes, the doctor has confirmed that. Now, according to International Diabetes Federation, 415 million adults in the world were recorded to have diabetes in 2015. Now, this number is expected to increase to about 642 million by 2040. 9% of adults between the age of 20 and 79 years are estimated to have diabetes.
Diabetes, excuse me, is becoming prevalent in children. In 2015, 542 1,000 children were diagnosed with type 1 diabetes globally. And the agency says in every 6 seconds, one person dies of diabetes. Now, the International Diabetes Federation says 14.2 million people in Africa had diabetes in 2015, and it is estimated to increase to 34.2 million come 2040.
Now, more than 2/3 of people with diabetes in Africa are undiagnosed. The World Health Organization says about 5 million people are still living with diabetes in Nigeria, while 1.56 million diabetic cases were recorded in 2015 alone. Also, 40,815 deaths in adults due to diabetes were recorded in the same year. Doctor, talk to us about this type 2 diabetes and even more worrisome, the juvenile diabetes. We hear is on the rise now.
Yeah, type 2 is the most common form, like you rightly said. Now we are having children. Before, the type 1 is what we find in children, and it's because they can't produce insulin at all, and so they need to be on insulin injection for the rest of their life. Now, for the children coming down with type 2 now, it's part of lifestyle. What do we pack in our children's lunch boxes? Now it is a show of I have arrived, and so it must show in the pack of my child in school.
Social status.
Social status. 2, most of the schools that we have today don't have playgrounds.
You can say that again.
And so these children don't exercise.
Isn't that where government policy comes in?
That is one of it.
Yes.
Good. Because an official will have gone to look at those schools and license it.
Schools before you approve.
Yeah. No. Now, when they come back from school, we don't want them kidnapped, so they are at home after homework watching TV. So
Well,
no
sleeping.
exercise. My days on the streets, we roll tires, we play football, we do all those things.
Good old days.
It's not there again. So these children are no longer exercising, and they consume calories, and so they become fat. And so we have a lot of them coming down with diabetes.
It's really sad.
And so it's now that is one group. It's like a gunpowder, sitting on a gunpowder keg that's going to explode later in life.
Okay, we don't have all the time, but Osanko, I like your, you're just happy. You're rocking, you're bubbling, and I love it. That's the kind of disposition, actually. But how do you imbibe that? Because that has to, our people need to imbibe that, because just like we said earlier, it's not a death sentence. You can live as normal as it is. And I guess this disposition, this happy disposition is one of it. But how do you imbibe that? How do you overcome? How do you get there?
Well, I decided when I saw my mom passed on, because she passed on when I was planning my wedding. So I am the last child. So I told myself, I'm a health activist from a very young age. So I had it in my spirit that this monster, I'm going to overcome it. And that's like I said, I was very lucky. The first doctor I met did a good job of me by giving me confidence. So I had 4 of my children living with diabetes. I mean, having diabetes, gestational before living with diabetes. I have 5 children. So I just believe myself, because I'm a very, very strong-willed person, and I have strong faith. So I will advise anybody who, don't be afraid. I just came up with that. I'm not afraid. So I took it on. I just took diabetes on. Say, you're going to be behind me, I'm going to lead. So, and my doctor told me, look, you are the first doctor. You are the first doctor before me, the doctor. So you have to know so much about diabetes. You have to manage yourself. You have to know how to test your sugar. You have to know everything. And you have to watch your diet. Just, you are your doctor. That's how I took it. So, and I took it upon myself. If I am going to overcome this, I'm going to be happy. And then my family, you need a family support. My husband was there, though he had his challenges, because the bill is huge. And then when I was having when you have crisis, like in that early stage, you don't understand exactly. You're seeing people just dying. So there's this fear that comes on you that you're going to die someday. Because there was this belief, because something the doctor said that when you ask the question, there to some people is a death sentence. Yes, you don't believe them. The cost of living with diabetes is expensive. And not everybody, like I told you, endocrinology came to me when I had the first
accessibility.
Yes. So many people don't have access to endocrinology, and they don't even know what endocrinology is. And with the factor in the country where physicians will want to maintain a patient and treat until it becomes difficult, or now they are now at a very bad stage. They refer to the general hospital. But if you go to most government hospitals, they have endocrinologists there.
Okay.
So the private hospital will not want to let go, most of them, and they don't know how to manage. Diabetes, you need to be trained on how to manage diabetes, and then you can educate your patient. I had the spirit of, I'm not going to let this weigh me down.
Yes.
So I overcame diabetes early. So I will advise anybody.
That's wonderful.
Spirit,
I must say that's really great. And congratulations on that.
Thank you
because
very much.
that happy disposition is first.
And I carry my children
And the same
along.
applies to any condition, any
Any
illness for that
illness.
matter.
Your spirit is what
It's number
helps
one.
you. Yeah.
Osaiho Chima Nwogogo, thank you very much for coming
You're
on the
welcome.
program. And
Thank you.
Dr. Ifedayo Odeniyi, thank you for coming on the program.
It's my pleasure.
Thank you so much.
It's really an interesting morning with both of you. Thank you.
Thank you very
We'll
much.
go on a break now and then we'll come back with the other discussion. Stay with us.